Following the detailed reports on transportation from day one, the 2026 Lagos State Ministerial Press Briefing continued with a deep dive into the Ministry of Health. Commissioner for Health, Professor Akin Abayomi, took the stage to outline the administration's scorecard and its ambitious roadmap for the future.
That allow Lagos to protect itself from shocks. So what we experienced during COVID, where we ran out of consumables, the market forces and the demand forced. So if we're able to produce our drugs, our vaccines, our consumables...
The commissioner opened with some tough numbers. He stated that Lagos currently needs 40,000 doctors to serve its massive population.
Now we need to increase our human resources for health. We know that. According to the WHO, we should have 1 doctor for 600 population. So that means for Lagos, for Nigeria, we need about 300,000 doctors, but we only have 40,000. For Lagos, we need 40,000 doctors, but we only have 7,000. So there's a shortfall of 30,000 doctors in Lagos and a larger number of shortfall for nurses. Let me just highlight that many of our healthcare professionals are at high risk of experiencing burnout. Burnout is a phenomenon of excessive workload. We need a healthcare financial reform that's critical because it's all about money. We need to improve the working conditions of our healthcare professionals. We need to improve the living conditions of our professionals and facilitate the return of those that have already drained out of the country.
He stated that the ministry is working closely with airport authorities to monitor for viruses like Ebola and the hantavirus.
We have what we call a biosecurity shield. We work very closely with the airport, port authority, health port authority, and the borders. And whenever somebody comes in that has a suspected illness, it is picked up at the airport and we are able to interrogate what's going on there and identify the situation. We've started to design the Infectious Disease Research Institute, which will be built at the mainland hospital. It's a much larger facility. We know that in Lagos we have to have our surveillance up to par at all times because we have a very active influx of people and animals.
The commissioner noted that malaria remains a major battle, but the strategy is getting smarter. He announced that Lagos is now creating a malaria heat map to track exactly where the disease is hitting hardest. By identifying these hotspots, the government can send resources exactly where they are needed most. Alongside this, he spoke about a major push to educate the public on prevention and the regulation of traditional medicine practitioners.
The Traditional Medicine Board gives a seal of accreditation to anybody that has gone through the appropriate training and they're able to identify the herbal combinations that they're using to ensure that these herbs are not the toxic herbs that can have effects on our organs that we described. It is common practice across Nigeria and Africa for these concoctions to be consumed, and no doubt they do have some toxicity. And that is why we have established the Traditional Medicine Board. That's why we're very eager for them to have their headquarters. They also have some satellite stations. They grow their own herbs, and we're able to do appropriate evidence-based research on the drugs that they're marketing. And they have to have a NAFDAC qualification and a NAFDAC serial number.
Interestingly, the commissioner also announced a plan to build sick bays in schools to ensure children get immediate medical attention. Perhaps the most important part of today's briefing was the discussion on health insurance. The commissioner stated that currently only about 10% of Lagosians are covered. He said the state's goal is to move that number to 50% by enforcing mandatory insurance. He explained that this shift will provide better care for everyone, especially nursing mothers and children. By making insurance mandatory, he stated that the state aims to make healthcare affordable and sustainable for every household. As the briefing wrapped up, the commissioner shared a vision for Lagos to become Africa's top medical destination by 2052. He described it as an ambitious plan to move the state from just treating the sick to protecting the healthy. Thanks for watching. This is Ask Lagos.